Hi, this is Dr. Ghadir, and thank you so much for joining me on Fertility Talk. I hope you're doing well. Today I was going to talk a little bit about miscarriage and some of the myths involved and some of the real implications and reasons of why people have recurrent pregnancy losses or habitual abortions or miscarriages as they are called. So some of the myths that I wanted to make sure that everyone was aware of was myths such as wearing high heels causes miscarriages, or activities that you do that cause miscarriages. Overall speaking, very, very few activities that you can do can cause a miscarriage. Now, I always tell people to be careful, and any kind of extreme action or extreme exercise can cause a miscarriage and can do anything to be harmful to the human body, but generally speaking, activities such as exercise that are done in moderation are totally fine. So just remember the things that your grandmother told you, like wearing high heels, do not cause miscarriages. Also, moving your body in a certain position or raising your hands or things like that, they don't cause miscarriage as well. Some of the real reasons of miscarriage, they're divided into different categories. The first and most important reason that people have miscarriages has to do with their body reacting against the pregnancy, and if their body's autoimmune levels are elevated, you have the potential of causing a miscarriage by the body rejecting a pregnancy. So having autoimmune checks, we call that a recurrent pregnancy loss panel in our office that checks for those levels of hormones, is one of the first and most important. The second thing to consider is a thrombophilia panel, or a panel that has to do with blood clotting factors. Generally speaking, if you have a family history of blood clots, it is an indication, but for some people, just to be on the safe, conservative side, we also recommend the blood clotting factors as well. Another area is the actual uterus. Are there anything growing or abnormal in the uterus that could potentially be causing the loss of a child or of an embryo? It's really important because fibroids, which are abnormal growths of muscle inside of the uterine wall, if they're bulging into the uterine cavity, can cause some problems. Also, having other things like polyps or a uterine septum, which is a kind of a wall growing in the middle of the uterus. All of these things that grow inside of the uterus and don't keep the uterine wall like a perfect little triangle the way it's supposed to be, just kind of like this, can cause an issue. If the embryo implants itself on an area where there's a fibroid or on scar tissue or on the uterine septum, all of these areas have a lower level of blood flow through them, and for that reason they can cause a miscarriage to happen. So these are really, really important reasons. And the way that we evaluate the uterus, we can do what's called a saline sonogram, where we put water inside the uterus and then do an ultrasound, and it tells us if the inside of the uterus, when we fill it up with fluid, is totally normal, or if there's a problem with the uterine cavity. Another test that we can do is called a hysterosalpingogram. I'm licensed, I do them here at the office. Many doctors send their patients to radiology offices. If you could find a fertility doctor to do it, I think it's definitely a better test to do with a fertility doctor. But the hysterosalpingogram also tells you the overall shape of the uterus, making sure that it's normal, and also if the fallopian tubes are open. So an HSG or an HSS, hysterosalpingogram or hysterosaline sonogram, are the important tests to evaluate the uterus. Additionally, there are problems with chromosomes, both the male and the female, that could affect miscarriage. If there's a tiny abnormality on the male or the female who is producing, the sperm or the egg of the embryo has a small abnormality called an inversion or a deletion or an abnormality of any kind on the chromosome, that can cause to miscarriage as well. So we've talked about the reasons such as autoimmune, we've talked about blood clotting factors, we've talked about the uterus and the anatomy, we've talked about the chromosomes, which are called the karyotypes of both mother and father. In this situation, the father's matters as well. And then we have to talk about just general things like general health, like being overweight, or having gestational diabetes or underlying medical issues that can cause miscarriages away all the time. So we want people to be as healthy as possible during this entire process. If people have more questions about recurrent pregnancy loss or want to talk about it more, feel free to reach out to me. I'll be doing my best to answer questions, or we can set up a consultation to discuss. Thank you so much for listening, and I hope this was a helpful little discussion.